Just say, you're the boss. 94% of the time, if the doctor interrupts, it's not like, no, stop, doctor. I haven't finished. I want to share with you all my concerns. 94% of the time, patients shut up when the doctor starts talking. And then doorknob disclosures are this idea that you have in your mind that, okay, this is what I'm really concerned about. This is why I'm here in the first place. And the doctors start to leave, and you go, oh, by the way, this is what's going on. I have, there's a gavel up my butt. I forgot to tell you that one. Ooh, it looks like I'm pounding the world. Oh, that's law and order right there. Okay, so the communication, the who talks and who listens and all that type of stuff is unequal. There's not an equitable pattern. The end of this little section is really important, I think. Again, this is on page 47. This inequitable pattern of talking and listening may occur because health professionals feel rushed and because they have trained to zero in on specific causes of illness. At the same time, patients may consider it rude to be assertive with health professionals. However, when patients do not speak up, their caregivers may have inadequate information with which to make diagnoses and suggest acceptable treatment options, and patients may feel belittled and frustrated that they did not express what was chief on their minds. In the end, not listening may waste more time and energy than it saves. So lots of things going on. Questions and directives. Typically, most of the talking time that happens, and we're thinking about very typical, I'm in the room, waiting for the doctor comes in, I'm talking to the doctor. Most of the talking times are questions and directives. For example, physical therapists usually talk about twice as much as their patients. So most of the talking is the doctor's talking. Mostly asking about health concerns and then giving instructions. So, what's wrong? Why are you here? What hurts? Okay, do this. So, questions and directives. Why? Why has all that stuff happened? In part because of the system and time constraints. Remember the whole managed care, blah, 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 depending on HMO, PPO, or whatever, but you got to see so many folks, blah, 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 blah. Yeah. So maybe, we need to be questioning the system, because is it the system and the culture that creates these time constraints, which then sort of, sustains this inequitable communication pattern? Blocking. Moves to talking about blocking. Remember, all this is under the section of medical talk and power differentials. Doctors have more power because they have more knowledge. They talk a lot. Don't listen all the time. Question us, give us directives, and then blocking. It's a block of cheese. I just thought it was fun. I like cheese. Okay. See, I like cheese, but doctors don't like emotions. I mentioned this previously, and so I would talk about this. Blocking is a process by which people steer talk away from certain subjects, generally speaking. Health professionals sometimes use topic shifts and questions to block patients' complaints and to avoid their emotional disclosures. For example, when Diane Morris and colleagues analyzed medical visits involving people with lung cancer, they identified 384 opportunities for the physicians involved to display empathy. However, the doctors expressed empathy only 10% of the time. But the thing is, in a lot of ways, caregivers as well are cultured, socialized to view the relationship in a particular way. And a lot of their training, Burke calls this occupational psychosis. Remember Thomas Dolby from the 80s? She blinded me with science. She blinded me with science, blah, 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 blah. In a lot of ways, doctors see their job as a very task-oriented job, particularly within this culture of the biomedical perspective, Cartesian duality, the machine thing. It's just like you're taking your car to the place. They don't ask you how you're feeling about your car. It's just, they just lift up the hood and just see what's wrong. In a lot of ways, that's what happens at the doctor's office. And that can be problematic. So a lot of folks, what they're doing in med schools are rethinking some things and trying to challenge the way they do things. But so this idea of blocking is important. Not only are patients sort of socialized, we learn to sort of disempower ourselves, but doctors and caregivers often learn as well that they should be dispassionate. Also, there's been research about patronizing behavior by doctors or caregivers by, in part, withholding information. We already talked about the therapeutic thing, which I think is just disgusting. Speaking down to patients, shrugging off their feelings as childish or inconsequential. But remember, they have this sort of science outlook. They know a lot of stuff, right? And oftentimes, to get through the day, they can't. It's hard to emotionally sort of engage with everybody. But in any case, so there's been research about that. But oftentimes it's about interpretation. Everything's about interpretations. Some people can perceive or interpret something as rude, while the other person goes, "Oh, not so much." Depends on culture, region, context, everything. So that's another thing. And then, don't cross that line. There is this sort of sense that we have these transgressions. We don't want to cross the line of intimacy because it's a very sort of specific context, right? When you're in the doctor's office, you have to take off your clothes for something. That's a very science sort of thing. It's not a hot date. But there's some interesting information there. They say that caregivers often ask too much information, and doctors feel uncomfortable, and sometimes obviously patients have been abused. So there's some more interesting things about why we have this sort of power differential generally. So why do we create, or at the end of the day, I've already said lots of whys, but what's going on here? Why do we have this sense that I'm just a patient? This is the doctor, doctor's orders, patient compliance, and all that type of stuff. A lot of people see that the whole idea of power, power is not necessarily just negative. It depends on how you use it. But what we see is that, and I do like lopsided, it's a really cool word, that in a lot of situations, the power struggle or differential is lopsided, where the doctor, the caregiver, has all the power, most of the power, and we as patients feel disempowered. That's the big news. And the consequences of that are very, very problematic if, obviously, it impacts your health in a detrimental way. So why? Sometimes we feel like we don't have a choice. Again, the system. We're rushed in there. People get anxious and frantic and don't always say all the stuff they want to say in the doctor's office, right? I didn't have the time. I couldn't, and this is just the way it is. Oh, Bruce Hornsby told us that's not the case. Another thing, Well, the same thing happens to me. Oftentimes, doctors feel like they have to take control. Uh, Oftentimes, there's just deep-seated cultural norms. Again, I've been saying that a lot. That we think that the doctor has the more knowledge, more power. So we got Catherine Green's disclosure decision-making model, which proposes that patients do not simply say what is on their minds, but weigh key factors like about outcomes. How is the other person likely to respond? Can I share this information effectively? So, for instance, if you trust your caregiver, you think about that. If you don't trust your caregiver in the first place, it's like, well, I'm not going to talk about this. The person doesn't care anyway. That's problematic. Trust is important. Oftentimes, because of, so this is more reasons why we have this relationship, this more traditional sort of relationship between patients and doctors. Institutional routines. Again, go in, the nurse does her thing or his thing, weighs you, checks your blood pressure and all that type of stuff. So we have been learned, that we're like cattle, right? We're going through the thing, and then we pay our copay, or pay our copay beforehand. This is the idea of tyranny of the urgent. That, this is urgent care, or this is the ER, or whatever. I cannot be nice to you. I cannot, listen to you. We got to do blah, 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 blah. Oh, and then the ethical bind. Don't want to cross that line. I don't want to cure your feelings, because maybe that would create some sort of, deeper relationship. And I don't want that. I don't want that kind of relationship with you. I don't want to hear about your problems. I know what your problem is. You got you got the cooties. Here's the pill. So we got all this stuff. The traditional sort of doctor has all the power, most of the power, blah, 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 blah. Now, what? It all depends on context, but right. Probably have ascertained that the book and me and lots of folks would say everything that I've discussed is problematic. That we actually want to have a relationship with our caregiver that is more equal, that is not asymmetrical, that is symmetrical, because the idea is perhaps the outcomes, that is a healthier, better life, is enhanced if we have more collaboration between patient and provider. So that's why we have this big idea of the collaboration communication model. We got to collaborate, also known as collaborative medical communication. What is that all about? Logs. Captain's logs. Sort of just came to me. So there's a really good example about how, some doctor was talking about a patient to basically offered an analogy or a metaphor to help his patient or her patient better understand what was going on. Which is, pretty cool. I mean, it seems simple, but, I'm not going to offer you all this medical jargon. I am going to actually try to effectively, teach you what's going on here. So we have shifted. Why have we shifted from this idea to asymmetrical, doctor has power, I'm just compliant patient, to this idea of collaboration? Well, we know more stuff. We've got WebMD and all the other things. But in a lot of ways, we as patients have gained a lot more knowledge. It says here on the bottom of page 51, it's the rare physician who doesn't acknowledge that now more than ever physicians learn from their patients. I found this, whatever. I found this out, blah, 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 blah.